brief about what happened exactly. So my husband's father died from COVID-19. He would have lived had he got a hospital bed on time. He was a senior officer with the government of India. He got the virus from a colleague in office. After which, when his oxygen levels fell to 93, we tried to get him admitted to a government hospital, which is supposed to take in patients, people who work for the government. But he did not get a bed on time. And by the time he got a bed, his situation was quite bad, and his lungs were more than 50% infected. So, but that's the situation. At least he got a bed. Right now, the current situation is that people are scrambling for basic things like medicines, oxygen. There are pleas coming on in social media handles every day. I recently got, my grandfather recently was outside a hospital for 2 hours with 70, that was his level of oxygen, fighting for his life, and there was no bed given to him. He had to, sit in the hospital corridor waiting for a bed. That's how bad the situation is, and many people are dying at home because they're unable to get access to basic resources. According to a research by IIT Delhi, I think they said that the death tally is probably somewhere. So right now, I think the government is saying it's 204,832. IIT is saying it's in millions. They did not give an exact figure. They're estimating that it could reach around 4 or 5 million over the next 1 or 2 months. And that is a conservative estimate, because the problem is that a lot of the deaths because of COVID-19 are not being reported. A lot of the funeral homes, like for example, when I went to do the funeral of my father-in-law, we were told that if we don't classify it as a COVID-19 death, then we can do a normal funeral. That's just one case that I'm talking about, and I'm sure there are there's mass funerals happening. There are so many people who are going into hospitals and getting the COVID-19 infection. So if say someone like a lady recently, she was pregnant, gave birth in the hospital and got COVID-19. Wow. And died. Mm-hmm. But the death report did not state that. Another big issue is that hospitals are accountable if they have more reports from COVID-19. So the cops are getting involved if there are deaths from COVID-19. Mm-hmm. Which is why a lot of the hospitals do not want to report deaths from COVID-19. Medications which are not prescribed for COVID-19, they are doing it from hearsay. They're doing it. You're hearing about it on social media. That's dangerous because you don't know how the body will react. There are people who are taking steroids at home without it being administered by a doctor. I was myself told by a lot of people to take medicines like ivermectin and doxycycline, which are not proven to be effective against the coronavirus. Mm-hmm. So this is what is happening right now. There are a lot of reasons. The first one, obviously, is that the government was very confident that we have a high recovery rate. So even if the infection spreads, it won't be an issue. What they did not estimate was that there will be a lot of deaths from basic necessities. A lot of the people, their oxygen levels, even if they fluctuate slightly, they do need medical attention. They do need oxygen. And the government did not estimate the need that will arise if the mutation spreads. The other issue is that this particular government, the BJP government, does not take the advice of experts seriously. It does not take data seriously. It fudges data. It is very brutal in clamping down on people criticizing the government. So there have been calls since last year to not get rid of makeshift beds, to not send vaccines to other countries when people in India themselves are unable to get vaccinated. And now the action that the government is taking, it's not enough. They're asking, the Prime Minister of India asked people to stay at home in mid-April when he gave a speech. But yesterday he tweeted saying that people in the state of West Bengal should go vote to celebrate the festival of democracy, which why would you even ask people to go vote when you know the situation is so bad, even if you ask them to vote under COVID-19 protocols? Mm-hmm. Thank you.